Hi, my name is Nicole Redvers, and I'm presenting today on behalf of myself, my co-authors Mia Wilkinson and Courtney Fisher on colorectal cancer community engagement, Indigenous voices from North Dakota. And rooting ourselves within Indigenous communities, it was important to orient our research poster in regards to the bridging of Western Indigenous ways of knowing. So you'll notice on the introduction, we have also a reflection piece, which is setting the stage of the work, given the fact that American Indians present generally with higher rates of advanced stage disease for screening detectable cancers, have a lower level of basic cancer knowledge, and often have more negative attitudes about Western cancer treatment than non-American Indian patients. And previous data has demonstrated 1/3 of screening eligible American Indians in the Great Plains, which is known to have higher cancer morbidity and mortality within American Indians. We're not planning on receiving cancer screening. So we really sought to identify the perceived barriers and facilitators for the engagement with colorectal cancer prevention, specifically within North Dakota tribal communities. And you'll see in the graph in the middle that the GPRA, or the Government's Performance and Results Act, set a target goal of screening in 2016, just about under 40%. However, it's important to note that the Healthy People goal of 2020 was 70.5%. And we can see very clearly that the Great Plains is within the bottom 3 of all of the Indian Health Service regions within the country. We carried out 12 semi-structured interviews across all 4 tribal communities with adults between the ages of 30 to 75, utilizing purposive sampling to ensure maximum variation in age, gender, and tribal community until we reach data saturation. Part of the analysis process of developing themes identified 4 main themes for barriers and 3 main themes as facilitators. For barriers, colorectal cancer screening barriers specifically were outlined: a focus on other health problems, lack of colorectal cancer tailored health promotion, and sociocultural factors affecting colorectal cancer prevention, with facilitators including reasons for getting a colorectal cancer screen, the role of culture, and getting out into the community. Now, what's important for us in terms of identifying barriers and facilitators and within a qualitative realm of elevating Indigenous voices, we included a number of participant excerpts that demonstrate some of the themes that were identified. For example, in terms of some of the barriers noted before focused on other health problems, we see a quote: "I just think that cancer is a tough topic, and I feel like, honestly, I think that cancer gets outweighed by diabetes within Native American populations, like even within myself." And when talking about the importance of culture, our people always had some type of root or medicine in their mouth because it was always about prevention. And I think that's always, it's ingrained in our culture. It's that, prevention, we take care of ourselves. And then also, in terms of barriers, very striking, our clinic might not be at capacity. So a lot of us drive 2.5 hours to get care. So when we are willing to take that drive, an hour and a half, like 2.5 hours to get care, when we are willing to take that drive, it's like I need to take that drive, like something wrong is happening. So I need to take a whole day off work to go to the hospital or to the clinic or whatever. So yeah, it's an access to service type of thing. So we saw repeatedly the need for more community-rooted, strengths-based approaches to colorectal cancer prevention activities in American Indian communities, specifically in North Dakota. And sociocultural factors really have been demonstrated to be an important element of consideration for colorectal cancer tribal community engagement and prevention planning in the state. And as part of our write-up, we're able to go into more depth on some of these powerful concepts and words coming from Indigenous communities on engagement with colorectal cancer prevention strategies. So thank you for your time today, and happy to entertain any questions or engagement on this topic area.